Hi everyone! Welcome to my channel. My name is Lisa Flanders. I'm a physiotherapist in Ottawa, Ontario, and I practice in women's health and pelvic floor physiotherapy. I'm so excited to be starting this series, which I am calling It's Not TMI. So often I have patients that come into the clinic, and one of the first things they'll say to me is, "This might be too much information." I'm just here to set the record straight that in a healthcare setting, there is no such thing as too much information. The more information that you can give me, the better equipped I am to help you. This series was designed to answer the common questions I hear in the clinic. Each week I'm going to be answering a new question that you might be too embarrassed to ask. So let's get started. This week's question is, what is the difference between the vulva and the vagina? This is an excellent question and one that I hear all the time. To help me answer this question, I'm going to use my favorite educational tool, the wondrous vulva puppet. The vulva is the external female genitalia. This is the part that we see. Often when someone refers to the vagina, they actually mean the vulva. Women have two folds of skin that are typically covered in hair. The large outer fold is called the labia majora, whereas the smaller inner fold is called the labia minora. The labia are there to protect the structures and tissues within. Next we have the clitoris, which is found on top of the labia. It has thousands of tiny nerve endings in it. This overlying piece of tissue is called the clitoral hood, and it is designed to protect the clitoris. Below the clitoris, there's a tiny opening called the urethra. If you spread the labia minora slightly, you should be able to see it. This is where urine comes out of. Below the urethra, we find the vestibule, which is the opening to the vagina. The vagina is essentially a hallway between the uterus and cervix and the outside world. The walls are made up of muscles, nerves, mucous membranes, and connective tissue. The vagina typically sits in a closed position and then just conforms to whatever shape it needs to conform to. The perineum is found at the bottom of the vulva. This is a connective tissue structure that also acts as muscle attachment. This is the space that we find between the vagina and the rectum. It's important to note that, like a fingerprint or a snowflake, no two vulvas are exactly alike. Each vulva is just as unique as the person that it belongs to. I'm going to highly recommend, after watching this video, that you take a mirror, you find a private space, and you look at your own vulva. Try to identify each of the structures that I talked about today. This is important to increase your brain-vulva connection, which is necessary for overall pelvic health. This is also going to allow you to identify any tissue changes, increase your body and sexual confidence and awareness. I hope this video answered some questions that you had. Don't forget to tune in next time when I'm going to be answering some more of your embarrassing questions. And just remember that it's not TMI.